Hey, I'm Dr. Ranicki with Dr. Ranicki's Creating Wellness Center in Savannah, Georgia. When I was a child, I was a very sickly, very unhealthy child. I had a lot of health issues, and one of those that probably was the most difficult to live with was asthma. I felt like I was constantly fighting to breathe, having to go into the bathroom, close up the room, and steam it up with the shower, or put my head over a pot of boiling water with a towel, just trying to open up my airways and be able to breathe again. But when I was 10 years old, something amazing happened. I wound up in a chiropractor's office, not for that, but instead for scoliosis. But within 2 months, my asthma was gone. Instead of carrying my inhaler in my pocket and having to use it 15, 20 plus times a day, every day, I was able to get off of that altogether. And I was able to breathe well and be able to go outside and run and play with the other kids without worrying that it was going to lead to and trigger an asthma attack anymore. And over the years that I've been a chiropractor, 20 plus years at this point, I've had many patients come in with asthma. And some of them, it just hasn't helped, but most of them it has. So how in the world could chiropractic change something like asthma? Well, at its core, what asthma really is a constriction of the airways inside the lung, the bronchioles we call it. And what causes those to become constricted is the muscles that make them dilate or constrict in the first place. And muscles are going to do whatever nerves are telling them to do. So if the nerves of the body are malfunctioning and misfiring, that can cause those muscles to constrict the bronchioles when it's not appropriate and when it's not necessary. And there's two main parts of the nervous system that play a role in this. There's a nerve that comes out of the very top part of the neck called the vagus nerve. It's short for vagabond or wanderer. And the reason they call it that is because it makes a stop at almost all of the major organs of the body. It goes to the heart, and it goes to the lungs, and it goes to most of the organs of the digestive system and many others as well. And it tells those organs that everything is okay, everything is fine, we're not in danger, we don't need to fight for our life, we don't need to run for our life, everything is safe. Then you have other nerves in the mid-back that go to the lungs, and their job is to tell all of those same organs that, holy cow, we might die, and we need to put everything into fighting for our life or running for our life. And there's a nice balance that has to happen between those two different parts of the nervous system. But they can become out of balance, and it can make it to where your body is always behaving as if you need to fight for your life or run for your life, even though that's not necessary and appropriate. Or it can do just the opposite. It can make it to where when you need to really dilate things big because you need to breathe a little deeper so that you can go run, that your brain can't get that message to those bronchioles and you don't have the ability to dilate them and make them get bigger the way they're supposed to. So problems in the nervous system are one possible reason that somebody could have asthma. It's not the only possible reason. And this is the reason that not all cases of asthma respond with chiropractic care, but many times they do. So how will you know if your case is one where chiropractic may help or not? You just simply have to get examined and evaluated by a chiropractor. And I would recommend looking for one that does some testing of the nervous system. We offer a very specific and refined type of testing of the nervous system that will help us to determine if you've got any malfunction or misfiring of your nerves, and we would be able to see if it's more of this one up at the top or the more the ones in through the mid-back that would be causing any kind of malfunction of those bronchioles and the muscles that control them, and be able to tell you whether we think it would be likely that this would be effective or not in your particular case. So if you've got asthma or your child has got asthma, I encourage you to try chiropractic care. It's not a system of treating asthma, but it is a system of making the nervous system work better, and that may very well be a powerful tool for helping you to be able to breathe easier, breathe deeper, and not feel like every day is a fight for survival. Thanks so much for your time and attention. Again, this is Dr. Ranicki with Dr. Ranicki's Creating Wellness Center in Savannah, Georgia.